Health webinar series. We're happy to be able to provide the series through a grant with the Refugee Office through the state of Vermont. And I'm just going to run through our disclosure slides before we get started. So this is our CME disclaimer, and we are providing continuing medical education credit and social worker credit for today. This session is going to offer 3/4 of a credit for CME, and you must claim the credit within 30 days. By the end of the day today, I'll be sending out details on how to claim this CME, so be on the lookout for an email from me. And this is just, let me go back. This is just our disclosure slide saying we have no disclosures and we did not accept any support. And finally, this is our Refugee Health page where you can see which upcoming webinar series are next. And it also, this session is being recorded and will be posted on this website on the recorded sessions section down below. So please visit this page as we're still adding some sessions. And on the website, which is listed at the top of the slide here, we list different resources, medical resources, health resources, and links to specific documents. And right now we have 2 speakers for today. Joe hasn't joined us yet, so we'll see if he joins a little bit later in the day, but I'd be happy to introduce Amila to everybody. She came to Vermont in 1995 as a refugee from Bosnia and Herzegovina, and is the first former refugee leading the USCRI Vermont Field Office. She brings over 10 years of experience working in refugee resettlement, providing direct services, program management, and advocacy on behalf of refugees and exiles in Vermont. Most recently, she graduated from the Fletcher School of Law and Diplomacy at Tufts University with a Master's of Arts in Law and Diplomacy. She holds an undergraduate degree in International Relations from Mount Holyoke College, and her interests span across disciplines including forced migration, human rights, and conflict resolution. So I'm just going to ask that if you have any questions, please direct them to me in the chat, and if time permits, I will ask them of our presenters. So now I will hand it over to you. Let me stop sharing my screen over here. And then you can share any presentation you have, Amila, or just go for it. Yep.
Great. Thank you so much, Bertie, for that introduction. And thank you for being here this afternoon. We're a small group, so I am going to try to make this more interactive. As Bertie said, I am the director of U.S. Committee for Refugees and Immigrants Field Office in Vermont. We are also known in the community as the Vermont Refugee Resettlement Program, VRP. So you might still know us by our former name. We have been welcoming refugees to Vermont for over 40 years. Our primary resettlement area has been Chittenden County, but we have also resettled refugees in other communities around the state, including in Addison County, Washington, and most recently in Rutland. I have been in this position for 8 years. As Bertie mentioned, I was resettled as a refugee from Bosnia and Herzegovina in 1995. And I started at the refugee program as a case manager working with Bosnians in 1998. And over time held different positions, for a short while worked under a mental health project, and left, pursued my education, and came back in 2014. Since the focus of this presentation is on strengths and challenges of the resettlement of Afghans, I will Actually, before I go there, I will just give you a very quick overview of the services and programs that we provide. And then I will go into the strengths and challenges of the resettlement of Afghans. And I will share my screen in just 1 second. Oh, we've done this long enough. I should be quicker, but I'm not. Can everyone see my screen?
Yep.
Yes. Okay. So I will just scroll back over here. This is just the brief overview of our services. We consider ourselves a one-stop shop. We provide wraparound services to all new arrival refugees, asylees, and most recently, Afghan parolees, and actually Ukrainian humanitarian parolees. And I'm gonna go into those definitions in just a minute. So our work begins before people arrive here. As soon as we get a notification that someone is coming, we start looking for housing. And as you can imagine, that is one of our biggest challenges, and it has been one of our biggest challenges, especially in Chittenden County with less than 1% vacancy rate, I believe. It's been particularly challenging during the Afghan resettlement. We provide health and wellness support to new arrivals, including setting up primary care for all new arrivals, also helping people access dental care and any other health services and mental health services that they may need. We have we provide support services, which include employment counseling and job development, English language training, and digital literacy. We live in the world, and the past 2 years have really made all of us shift how we operate and how we work. So a lot of it happens online, just like today. We can do a lot and not even need to be in the same room. We provide transitional cash assistance to new arrivals. The cash assistance is available to new arrivals up to about 8 months, between 5 and 8 months. We have a contract with the state of Vermont to provide REACH-UP case management. REACH-UP is a state program that serves families with children under 18. We have a robust community partnership program, and through that program, we connect new arrivals with volunteers and family friends and mentors. I always like to say that our work would not be possible if it wasn't for the support of our communities and volunteers. The 4 programs highlighted in blue are new programs we launched this year, and one of those programs is legal services. When I go into talking about Afghan parolees, I believe Joe from ECDC Birdie is texting me. He might have not gotten the new link.
Oh, okay. Sorry, I have.
Sorry about that.
No, that's fine. I sent him an email, but maybe I have the wrong email for him. Do you happen to have his email, or you could chat me his phone number?
Sure, I will just I can forward the link quickly.
Oh, okay. Great,
have
thank you.
right here. Yeah, sorry everyone. Okay, sorry about that. I mentioned legal services, which we implemented a couple months ago. Over the years, for refugees and for asylees, we provided limited legal services. Refugees, as well as asylees, after 1 year in the United States, they are required to adjust status and to apply for permanent residence. And then after 4 years and 9 months, they're eligible to apply for naturalization, for US citizenship. With Afghan parolees, as well as Ukrainian parolees, they were brought to the United States under a temporary designation known as the humanitarian parole. Humanitarian parole is a temporary, it's not even a status, it's a designation. It allows our government to respond quickly in a crisis situation and get people out of the crisis and bring them to the United States, and then process them from the United States, and then match them with resettlement agencies or with relatives or friends who are already in the United States. So when the US government pulled out of Afghanistan, about 80,000 Afghans were airlifted and initially brought to what's known as lily pads in various locations around the world, and then brought to the United States under this humanitarian parole designation. What that means is they will have to apply for another legal status. The humanitarian parole designation is for 2 years. The US government has extended the humanitarian parole designation for Afghans for 2 years. Generally, it's 1 year. And during this time, Afghans will have to apply for another legal status. Many of them who worked with the US government overseas will be able to apply for special immigrant visa, or SIV. Special immigrant visa is extended to Afghans, nationals of Afghanistan and Iraq, who worked with the US military or another US governmental organization overseas. Other Afghans who are here under humanitarian parole will have to apply for asylum. So our legal services have started assisting Afghans apply for asylum. This process generally is a very lengthy process. The US asylum backlog has about 1 million applications, but the US government is prioritizing applications, asylum applications from Afghan applicants. Moving on to other services, we provide a number of support services, preventive programs, youth empowerment programs. Also, we provide wellness support groups to families and individuals, intensive case management. We also have a social enterprise interpretation and translation program. And through that program, we're able to provide interpretation in about 30 different languages and translation services in about a dozen languages. We also offer citizenship classes, and in the coming months, we will be implementing mental health programming, so hiring a social worker and women's empowerment program, focusing on working with Afghan women and children. These are just some numbers, historical numbers of, let me just do this. In 2018, which is the year that, 2017, in fact, is the year that refugee numbers started declining due to the policies at the highest level. the policies implemented by the previous administration have essentially decimated the refugee program, both globally and nationally. So the resettlement numbers historically, the U.S. was, the leader in the number of refugees we were resettling per year. That number was always around 75,000 up to, at one point in time, 200,000. But once the new administration came in, they slashed the number in half and then reduced the number every year, reduced the number. So in 2020, once also the pandemic hit, the number of refugees coming to the United States was the lowest in the history of the program. And the number of people coming to Vermont also was the lowest in the history of the refugee resettlement program. We have a friendly administration, administration that is committed to rebuilding refugee program, both globally and nationally. However, the number of refugee arrivals remains low. And that is mainly due to, as I mentioned, the program was essentially decimated. So, and then the pandemic, obviously the impact of the pandemic. So only this year, we are able to sort of start rebuilding the program, but it will take some time for number of arrivals really to go back anywhere close to where they were a few years ago. So in the current fiscal year, we follow federal fiscal year, which starts October 1st. Our proposed number of refugees is 300 for the whole year and 180 Afghans. Currently, as of this month, we have welcomed 45 refugees and 173 Afghans. These are the communities where, the counties where we have resettled Afghans. As you can see, the largest number is in Chittenden County. And actually these numbers, I need to update these numbers. But the largest number of Afghans is still in Chittenden County. And then Washington County, we have 5 families. Rutland, we have 14 individuals and 1 family in Bennington, which actually is now working with Joe, my colleague Joe, and his team. This is just another way to look at arrivals historically by fiscal year and by different groups. As you can see, 5-6 years ago, our primary refugee group was Bhutanese coming from Nepal. And then in recent years, the number of Congolese has gone up. And then this year, the largest population is Afghans coming through the humanitarian parole program. This is resettlement by town in terms of apartments rented. When we think about the greatest challenges, well, number one is the number of people, the number of Afghans coming was really high. A high number of Afghans arrived in a very short period of time. And generally, with refugee resettlement, there's a little bit of a predictability and, we are able to plan. We get a travel notification. Generally, we have about 2 to 3 weeks. With Afghan arrivals, we were getting notifications of people coming within 24 to 48 hours. And at times we had between 15 and 20 people arriving all at the same time. This was also in November during Thanksgiving week. So you can just imagine the challenges we faced in finding temporary placement, host families, but housing was by and large the greatest challenge with this effort. As you know, we are experiencing a housing crisis statewide and particularly in Chittenden County. The number of available units and the cost of units has really skyrocketed in the recent years. The one benefit that we are able to access in Vermont, which is really unique to Vermont, is rental assistance through the Vermont State Housing Authority. And it is income-based, and most new arrivals meet the income eligibility, so we are able to access rental assistance for all new arrivals for a period of time. Here's the breakdown of average rent per apartment in Chittenden and Washington counties. As you can see, the difference is pretty stark. Refugee resettlement program is an early self-sufficiency, economic self-sufficiency through employment. So the focus is on helping all employable adults go to work as quickly as possible. So individuals who are able-bodied between the age of 18 and 64 are required to go to work as quickly as possible. And the goal is early self-sufficiency through employment. So our employment team works with new arrivals to identify their strengths and their interests and to match them with the best possible job. That first job may not be their ideal job, but it is a stepping stone. And it provides them opportunities to learn English and obviously to earn and take care of themselves and their families. These are just some jobs, types of jobs that we are accessing, and the wages, average wages. I can tell you that we have employers calling us all the time, asking for more people. There is a shortage of, a workforce in the state. So if there was housing in Vermont, I think we could easily accommodate, probably 3 times as many refugee arrivals in the state. We also offer education programs, English language learning classes. We offer classes online and in person. We have paid teachers who are on call and also volunteer tutors. Tutors are matched with new arrivals and they work with them one-on-one. We have about 100, this number has actually increased recently. We have more than 101 students registered in our English classes. And earlier I mentioned citizenship preparation, digital literacy. English for specific purposes is English at a work site. We are currently working with 2 employers, big and large employers, and offering an English class on site. And then as part of our Women's Empowerment Program, we have launched a Pathways to Higher Education English class for women. I mentioned Community Partnership Program as the backbone of everything we do. The support, the volunteer support, and the support of family friends is critical in our work. Volunteers help with transportation, anything from transportation, helping sort through donations that we receive on daily basis. Family friends are matched with new arrivals, and it's a 1-year commitment, and it's a peer-to-peer, sort of working hand in hand, and a lot of those matches turn into a long-term friendships. Through our preventive programs, we provide intensive case management. Many of our new arrivals are coming with really complex health and mental health needs. and are in need of more support. So the case manager works with them closely on overcoming, their health issues, or making sure that they are addressing their health issues, they're managing them, they're managing their medication, and also setting some goals for themselves. They may not be able to go to work necessarily, but perhaps they can join a gym and go and exercise once a week, or volunteer at an organization or something like that. We have served about 150 clients this year through intensive case management services. And on the bottom, you see the groups that we have served over the years. Refugee resettlement cannot be done in a vacuum. It certainly is a community effort. And these are just some of the organizations that are actively involved in serving refugees and Afghans in Vermont. This is just a quick overview of the future of refugee resettlement. As I mentioned, the number of refugee arrivals still remains low. In terms of the phase 2 of Afghan arrivals, we are also seeing a very few people. What we think is happening now is that people are looking to be resettled where they have relatives or friends, and where there are existing large Afghan communities. Our plans for the next couple years, again, it's still uncertain how many refugees will be coming in the coming fiscal year, but our proposal for Chittenden County is to start with 300 individuals in the next fiscal year, and then make incremental changes over the next 2 years. And also in Rutland County, we're looking to resettle 75 people in the coming fiscal year, 100 in the following year, and 150 in year 25. Again, these are projections, and we don't know necessarily if this is the number of people that we will end up welcoming in those years. So I will stop here and let my colleague chime in. Thank you.
Is it my turn?
Yes, Joe, feel free to go ahead. And then at the end, with time permitting, I'll ask the questions that are in the chat.
All right. Thank you, Amila. And sorry, folks, I was really struggling to find the link in the call. And what I had is that, well, it's canceled. So I thank you for Amila's text her, and then she was able to send it to me. So I have a presentation. Do I have a permission to share that?
Yes, yeah, you can share your screen with the green arrow at the bottom.
Okay. All right, so can you see my presentation?
Yes, yeah, that's perfect.
Okay, so for me, I'm starting with, I know Amila must have already mentioned that. So just going back, we opened our office in October 2021. And I came on board September 20th. And then other staff joined me, 2 staff joined me in November, the middle of November. And then another staff joined the end of December, and the January 3rd, we received the first arrivals. So that's how quickly things went from here. ECDC, as you may know, is one of the 9 refugees resettlement agencies, and headquarters is based in Virginia, but we have offices around. And last year we opened a branch office here in Brattleboro. So I, not to repeat what Amila may have said, I just want to start with who are refugees. And some of you already know who refugees are. So they are people who are forced to leave their country in order to escape war and persecutions. Refugees come from many different countries around the world, and most of them are hosted in neighboring countries. Of the 89.3 million displaced people, 53 are internally displaced people, and 46 million are asylum seekers. Asylum seekers are some of the people we hardly talk about here in Vermont, and 27.1 are refugees, according to UNHCR. In 2022, only less than 1% of all refugees are resettled each year, and the U.S. remained a beacon of hope for majority of the people, majority of the refugees. So between 2021 to 22, about 76,000 Afghans were evacuated to the U.S. ECDC, we resettled about 6,000 plus Afghans in communities across the country, and only 107 of that number came to Southern Vermont between January to, actually it was April, not June, between January and April that we had 107 individuals. U.S. has long history of welcoming refugees even before its founding. In 1980, the Refugees Act was passed, which is the legal framework for refugees resettlement in the U.S. Each year, the president, in consultation with Congress, sets the number of refugees allowed into the country, called the presidential determination. And the number for 2022 is about 125,000. And Amila mentioned that. An individual must first qualify as a refugee by the United Nations High Commission for Refugees, and then be referred to the United States Refugee Admission Program. Once approved, the refugees are settled through the Reception and Placement Program, which is under the Department of State Bureau of Population. And then they begin the process of resettlement. What is the determination process like? It's a lengthy process that takes 1 to several years for refugees. So just for folks to know, the APA program was a little different because we also, on our screen, Kabul fell. And so there was a rapid evacuation of people. So it's a little different from the regular refugees program. Individuals go through eligibility interviews, extensive background checks. Once preliminary approval is complete, they undergo medical examinations and initial cultural orientation. Individuals were to be booked for travel by International Organization for Migration before they get on the flight. Most refugees coming to the U.S. have U.S. ties. Unlike the APA program for us, none of the Afghans that came to Southern Vermont had Vermont tie or U.S. tie. I did mention in my opening that there are 9 national refugees resettlement agencies, of which ECDC is one, USCRI is one of the agencies as well. Each week there is a meet and decide meeting about which organization will take which arrivals. And for us, ECDC, we have an internal weekly allocation process to determine among arrivals those that will be coming, or those that will be assigned to each office. So I just want to focus on the strength of Afghan resettlement in Vermont, Southern Vermont to be specific. One of the strengths here was that because the state is so small, so it was much easier to reach out to key players here when we started. We got so much support from the state and federal agencies, technical support as well as financial support. There has been a public support from the town administration to the law enforcement. In fact, some law enforcement officers got involved in terms of, providing explanation as to what it means to what local laws mean, and how to build relationship with newly arrived refugees. Um, Public transportation for Southern Vermont is very hard to have public transportation here. We have very limited public transportation, but the Public Transportation Authority went all out of their way to create new bus routes so that they will be able to reach where refugees are. Academic institutions like SIT quickly came on board and said, look, we have the campus here. We will make our campus available. You can host refugees here temporarily. So all our refugees that came and continue to come go through SIT, and that gave us a breathing space. Once they're on campus there, then we start looking for permanent housing. Some of the good social services here in Vermont also help, like the Medicaid, the 3 Square, and particularly the Vermont Rental Assistance Program that is providing that 18 months of rental assistance or 12 months, depending, to each refugee's family is really helping. And we also had a network of volunteers. We use a model here called the co-sponsorship teams. It's a 7 to 10 individuals, volunteers that we organize, train to provide some of the services to refugees. And so what we do, we pair a family with that particular group, and then they sign an agreement with us to provide 8 months of wraparound services. And that really helped us because with our limited staff at the time, they took on some of the roles that we were supposed to play, but they really took it on. As families were assigned to them, they went out there looking for housing and providing transportation, cultural orientation in terms of showing people how to shop, how to open a bank account, and that really helped us a lot. Service providers here also, like the hospital, the pharmacists, the schools, all were willing to learn and play their part. In fact, there was an ad hoc groups that organized themselves right away from through Brattleboro Memorial Hospital to just identify healthcare providers, the doctors that were willing to take refugees. And that really helped. So by the time refugees got here, they already had their primary care providers. Prior community like the Afghan community, and to be, right here, Amila is here, USCRI really helped us from the beginning up to now to give us that, that context. Because it was our first time working here, and with my team, well, it was our first time, so most of them first time working in refugees resettlement. So that state context, the local context, we had to rely on USCRI to give us advice on how they have done things before, and that relationship really helped us to localize some of our approaches here. EALV was one of those two. And some of the healthcare providers from the north, the monthly mental health care, meeting that took place and continued to take place has been very helpful. I remember the first time I went to the meeting, there was an Afghan doctor that was invited, and his presentation was so good that it gave me an understanding, what to expect. And we used some of his talking points to provide training to our case managers. Challenges here for us in the south, the distance from Brattleboro to the nearest airport has been a very, very challenging piece for us. Our nearest airport is in Hartford, Connecticut, and so we have to drive all the way there to pick up clients from there to bring them here. Limited service providers for experience in refugees resettlement. Southern Vermont, since the 60s, the Vietnam War, and partly maybe the early 70s, had not been a refugees resettlement region. So most of our providers here have very limited experience in refugees resettlement. And so there was a lot of confusion from the very beginning as to who does what, and how they were going to approach refugees resettlement. It also created a conflict on clear rules and responsibility, um, because there was a time that some of the service providers, even including state service providers like AHS, thought that it was RA's, meaning Refugees Resettlement Agency's, role to play some, to provide interpretation services, to provide one-on-one case management for those that were enrolled into reach out and things like that. So there was a lot of gap in communication between us and them. Huge community interest is a good thing, and at the same time, it posed a challenge at some point to us because of that enthusiasm from community members. Everyone, sometimes most people also had their own way of defining what refugees resettlement should look like and wanting to draft the process. And we have had challenges trying to explain to some of our community volunteers and community partners that know there are strict requirements that we have to follow as a refugees resettlement agency. Cultural competencies in service delivery has been also, we're getting there, but it has been another challenge because for a long time, we have not had refugees resettlement in our region. So it was a kind of confusion as to what to do. Local politics play its part too. Availability of healthcare providers with multicultural backgrounds, translation and interpretation, mental health. These were challenges, and these are challenges we still face with. And also just for recruiting staff, finding the right staff and at the right time has been a challenge in our region here. And to focus more on the medical challenges, screening medical, securing medical interpreters before appointments has been a challenge. Sometimes some of the healthcare providers expect us to bring the interpreters, but we're getting there now. At least things have so much improved. But from the very beginning, securing those medical interpreters was so very challenging. So we had to cancel a lot of appointments. Just before the appointment, the person we get a call and say, "Oh, we couldn't find an interpreter." And also, clients understanding the importance of lab tests, especially stool sample, has been a very challenging thing for us. I think it's part of the cultural understanding, and we have tried to explain to some of our clients that lab about the importance of the lab result, but for some reason, the stool sample, just securing that stool sample and making it available for lab tests was a challenge. Appointment reminders calls again was another challenge because not in their language. So sometimes providers call them and say, "Oh, your appointment is going to be so time," but the reminder call is in English and the person does not understand English. It became a real challenge. Most dental health providers also in this region not accepting state insurance, even in cases of emergencies, has been a challenge. We saw an increase in dental health from arrivals, but we just didn't have. First, there's not enough providers, and second, with that not accepting insurance, state issues insurance posed a lot of challenges for us here. Some of our clients sometimes feel uncomfortable to speak with counselors if there is an interpreter. We have seen it that we think is part of the culture and we all learning through the process, but it sometimes poses a lot of challenge in terms of what a client wants to say, because our interpreter that they don't know or familiar with is in a room or is on the phone. Transportation, getting to appointments here is also a very big challenge. Again, transportation, we don't have bus systems. We have bus system, but not adequately enough to reach to far distances. And some of the primary care providers, not all of them are in Brattleboro, they are in different parts of the region. So getting on a bus and getting to your appointment has been a challenge. Then we also have challenges with pharmacists explaining the use of medication, because the pharmacists here also didn't have the capacity, language capacity, to be able to translate or interpret, how patients should take their medication. So they have put a lot of stress on our case managers, because almost all of this interpretation and going to the pharmacy, sometimes appearing for appointment with the with the client, put a lot of stress on what the case managers needed to do. Seeking gender-based doctors of physicians is also another challenge we have realized. We have had a few of our arrivals who said, I don't want to see a male doctor because I'm a female, or I don't want to see a female doctor or physician because I'm a male. And that part of I think is part culture, but then it poses a lot of challenges because we've already have very limited providers in the area. And so if a client chooses not to see a particular physician because of the gender, now it's making it so difficult to find someone that will be comfortable with. And this has been a challenge for us here. A way forward, we will continue to work with service providers here. Things have improved so much now from the beginning to now. At least we have consultations, we have group meetings. So healthcare providers in the area now have their own meeting. We have housing meetings. We have a meeting with AHS. And these, meetings are helping now to resolve some of the challenges we have and slowly building the capacity in our region. We have other providers like the Brattleboro Development Credit Corporation, BDCC, that is more focused on building a regional network of providers, not only for refugees, but any immigrant coming to the area. So we now have welcoming community meetings to address challenges facing immigrants in general, and not refugees alone. And that is also helping to bring employers on board, landlords on board, legal service providers on board, just seeing how they can help. And so far, that's it for me. Our projection for FY22 and 23, so Brattleboro, we're still focusing on having 100 individuals coming to Brattleboro for refugees. And then we will soon be opening an office, hopefully as of October 1 in Bennington. And in Bennington, we will have some staff based there. And the projection in Bennington is going to be about 50 individuals. And we slowly, as Amila mentioned, we slowly increase those numbers. For Brattleboro, the following year is 125. And for Bennington, it's going to be 75, which is 23, 24. And then the 25 is going to be for Brattleboro, 150, and then for Bennington, 100. So thank you so much for this time, and I open it up for question if you have any question for me. Thank you.
Hey, this question came into the chat, either directed at you or Amila. James asked, can you speak to any specific challenges pertaining to the Afghani population in Vermont, Is there anything that makes them stand out from other refugees that have resettled in Vermont? For example, mental health issues, trauma, health issues in general, or anti-Afghani sentiments in Vermont?
I can start and maybe Amila can come in. So I can draw the reference as to specific challenge to Afghan because we have for ECDC, this is our first here we only settle Afghans. We hopefully will soon be resettling Congolese as well as some folks from South America. So our population is slowly expanding. But yeah, we have had mental health. We start to see slowly challenges with mental health. We are not practitioners, so we don't know the extent, but at least we can see that. We reach out to ACRS, which is the regional mental health provider here in Brattleboro, to partner with them in terms of providing mental health services. Where we really now challenge is how to roll that out. The challenge has been how do you approach it, because the definition of mental health is a little different from how our population define it, and we don't want to for people not to access mental health services because of the definition and how to perceive mental health. So we really having that discussion with HCRS, and also consultation with some of the Afghan who are working with us to get to understand what kind of approach we will take, but we haven't reached that point yet.
I will just add that prior to the arrival of Afghans in, this group of Afghans, there really wasn't an Afghan community in Vermont to speak of. So we, over the years, resettled a few individuals. For example, we had one on-call Pashto and Dari interpreter who had a full-time job. His availability was very limited. But there are other Muslim communities particularly in this area, and we very early on reached out to the Islamic Society of Vermont, and they have been very welcoming, particularly the sisters group. They took it upon themselves to have a representation at the airport for every new arrival, every Afghan coming to Vermont. They had someone at the airport welcoming them. A group of women was cooking a warm meal for every Afghan coming in. We're required to provide a warm meal upon arrival. So the challenges are mainly around, as I mentioned, people were coming in sort of a very condensed manner. We would get an arrival notification that 17 people were coming in less than 2 days. So housing, again, was a great challenge. We partnered with Champlain Housing Trust. They acquired a hotel in Williston, and they let us use one of the wings of the hotel, which were suites, so rooms with kitchenettes. And we were able to place every new arrival there for about, I would say, 4 or 5 months. And then from there, look for longer term housing. Mental health, as Joe mentioned, is, certainly we're just starting to learn and beginning to understand, what people have witnessed and lived through, especially, those working with the U.S. military and in combat. Also, a large number of Afghans is about, I would say, a third of our arrivals are individuals who left their families behind. So they're here alone, and the rest of their families are. I know that's the case for all resettlement sites. The rest of their families are in Afghanistan, and there's a huge pressure on them, to support the family back in Afghanistan, and also constant worry, that they might be targeted because of their involvement with the U.S. military. Some of the other health issues we are seeing, dental health is a huge one. And as you know, Medicaid only covers so much. Community Health Centers of Burlington has been really great in, accommodating people's needs, but it is limiting. And yeah, I think those are the biggest ones.
Well, great. Thank you, Amila and Joe, for taking the time today to speak with the group that we had with us. And thank you, everybody, for joining. I'll be sending a follow-up email with CME information. And please, again, look at the Refugee Health page on the Vermont Medical Society's website for upcoming